Hello, this is Jacob Avila of 5 Minute Sono, and today I'm going to show you how you can identify a pericardial effusion using bedside ultrasound. So the probe of choice for this examination is going to be the phased array transducer. This is AKA the cardiac transducer, so anything cardiac, you'll probably want to use this one. The curvilinear probe, you can make it work, but phased array really is best. Now, as far as where to put the probe on the patient, you can put it in any of the four basic cardiac views, but the subxiphoid is going to be your best view. Now, what you're going to do is you're going to grab the probe with an overhand grip. You're going to put it in the subxiphoid area and just look around, angle until you see that subxiphoid view. So here's that ultrasound image of the heart. We have the liver over here. We have the right side of the heart over here, left side of the heart over here. And you're looking for basically any strip, any hypoechoic or black or dark strip in between the heart and the liver, the heart and any of the other surrounding structures. You're basically looking for hypoechoic fluid in the pericardial sac. This patient has like a crazy arrhythmia, but he also has a pericardial effusion. See that strip here underneath the left ventricle right there? That's an effusion. You can also see a little bit up here as well. Here's another one with a more stable heartbeat. See that fluid around the RV? That's an effusion. Sometimes those effusions can be pretty big. Remember that a lot of patients have effusions, and the size of the effusion doesn't really tell us if the patient has tamponade or not. It just tells us that the patient has an effusion, and an effusion of itself doesn't really cause too many issues. It's when it causes tamponade that you should be concerned. I mentioned earlier that you can use other views to diagnose a pericardial effusion. You might be able to actually get some useful information from those other views that you won't necessarily be able to get with a subxiphoid view. This is a peritoneal long axis view of the heart. And by the way, if you need help with exactly how to get views and how to optimize them, check out my video on obtaining cardiac views. What I want you to focus on here is that little circle right here, that little guy. This is a descending aorta and is a really useful landmark to tell if your patient has a pleural effusion or a pericardial effusion. In this view, it can be very difficult to tell the difference between the two if you're not careful and if you don't pay attention to the orientation of the fluid and the descending aorta. Here's an effusion. Take a look at where the effusion is in relation to the descending aorta. So here's the descending aorta and here's the fluid. So you can see here that the fluid is actually tracking anteriorly to that descending aorta, making it a pericardial effusion. But who cares? I mean, obviously this is a pericardial effusion, right? Well, look at this one. It actually looks pretty similar to the previous one, but look at the fluid in relation to the descending aorta. This is a pleural effusion because it's tracking behind the descending aorta. So here's the descending aorta, and the fluid is going behind the descending aorta. So this is a pleural effusion. One thing that is important to understand when you're evaluating a patient for a pericardial effusion is to not confuse an epicardial fat pad with an effusion. Look at this heart. Just look at it. So up here is a pleural effusion. Here's a small sliver of a pericardial effusion. But look at this thing right here. This is an epicardial fat pad. The main way that you differentiate it is that it is moving along with the heart. It's stuck to the heart. It's stuck on it because it's fat that's stuck on the heart. So if it's moving with it, it's very likely to be fat stuck on the heart. If it moves separate from it, it's more likely to be an effusion or clot. Now, some people talk about the echo texture being important, and it is, but this echo texture can be what clotted blood looks like. For example, look at this heart with really bad tamponade. This is that same echo texture of that epicardial fat pad, but obviously this is an abnormality. This right ventricle is completely gone. It's completely obliterated. This patient has tamponade, and this echogenicity looks like that echogenicity of that fat pad. The difference is it's not adherent to that RV free wall, and it's kind of moving independently of it. You can look at other views, but there's really nothing fancy or fun about the views. Here's a peritoneal short axis view over here with that fluid all the way around it. Here's an apical four-chamber with fluid all the way around it. So to recap, you want to look for hypoechoic fluid around the heart. Be careful with that epicardial fat pad. Don't confuse that for an effusion, and realize that there's a difference between tamponade and effusion. A patient can have a pretty significant pericardial effusion and not have tamponade. And on the flip side, a patient can have not a big effusion but actually have tamponade. I'm going to talk about tamponade itself in a separate video. That's it for this week's 5 Minute Sono. Please feel free to send me an email or a tweet if you have any questions or comments. And as always, don't forget to subscribe. Go to blog.5minutesono.com/subscribe. Type in your name and your email address in the little text boxes and never miss another video. And if you want this stuff to be pushed straight to your smartphones, just go ahead and go to iTunes or whatever other podcasting service you use. Type in 5 Minute Sono. Subscribe and make sure to leave me a review. Now, I know you guys love ultrasound. You watch the podcast, you watch the videos, you go to ultrasound podcast. You basically try to consume all this information the best you can, and that's great. It's the best way to learn. But the next step in that learning is to take that probe in your hand and put it on somebody so that you can actually see how your ultrasound transducer will generate those images so you can actually use them to save your patients' lives. Now, reading about it, watching these videos that I do, that the Ultrasound Podcast does, they're good. They're a really good starting point. But what you need to do is you actually need to scan physical patients. But I understand sometimes it's difficult to do it if you don't have someone there telling you what's the best technique, little tricks of the trade to make the examination a little bit better, a little more accurate. You need to come and scan with us. Scan with Matt Dawson, scan with Mike Mallon, Haney Malamet, Jean-Francois Maxime of EGLS, Chris Fox, Chris Muir, Mike Stone, Lale Garabagian, and Rob Armfield. You want to come and scan with all of us? Come to one of the courses. Come to Castle Fest, come to Yellowstone, come to Cabo Fest. Just come and learn from us. You'll have a good time. I mean, the ultrasound is definitely an important component of it, but we like to have fun too. Come hang out with us, learn ultrasound better, use it at the bedside, and save your patients' lives.
They know that I need the right electricity to move my disco feet. They know that I need a rhythm of ecstasy to get the disco feel. Baby, give me the song that keeps rolling all night long until the break of dawn. Baby, give me the one, 'cause we like to get it done before tomorrow comes. So don't turn back, 'cause we can feel the funky groove. Baby, don't distract, lose contact, 'cause we believe you got the moves. And baby, you seem to wonder why we got in disco light. You know I don't, you know I won't get it down. You seem to wonder how my funky-licious love. You know I don't, you know I won't fail you. Shoes on my feet, move to the pounding beat, unstoppable indeed. Looks irisy, tell me just what you need, a dancing disco dream. Baby, give all you got, 'cause this isn't good enough, can't take no fake or bluff.